Mahali Hlasa. I'm the program director for Riders for Health Lesotho. Lesotho is like, you might think it's part of South Africa. It's a country within South Africa. We are completely surrounded by South Africa. As you may see, we have a population of about 1.8 million. So it's quite a small country, but it's a very mountainous area. We have lots of difficult terrains, a lot of loose gravel. People like to build their houses on foothills, and it can be very difficult to get to those places. Sometimes there are no roads completely. We can get a road up to a certain level, and from there people have to walk. Our biggest problem now is HIV/AIDS and TB. Most of the people who are HIV positive, you find that they also have TB, and if they don't have information, even if they suffer, they have symptoms of certain diseases like TB or AIDS. If they don't have information, they might not even know that they might have a serious condition. So by the time they realize that, they might have infected a lot of people, and their condition also could have worsened. It means every person has to be reached, either with information or with drugs. Those who have to be on treatment have to start treatment as soon as possible, and we have to be able to trace immediate contacts. And it means every Lesotho has to be reached, no matter where they are. So mobilizing health workers is the biggest priority now, to make sure that all the drugs get to the people where they're supposed to, all the information that they're supposed to receive, they get it. What Riders is doing in Lesotho mainly is to mobilize health workers, community workers, all the health workers that need to do the outreach programs to go to the communities. They help them, like TB officers, when they are put on bikes. They're able to go to the villages to follow up all TB defaulters, to make sure that all the patients on treatment who can be hospitalized, they take their medication all the time. If it is time for their sputum samples to go to the hospital, instead of the patient going, they go and collect the sputum samples and then they give the results back to the patient. And if the patient has to be on treatment, they make sure that the patient takes the treatment properly by visiting them every day and making sure that they actually take the drugs when they're supposed to do so. Sometimes there are patients who are very sick in the villages, but they cannot walk because of the distance and the difficult terrain. They can't walk to the hospital, so the doctors have to go from the health center to go and see the patient at the house and take some medication or see what needs to be done for the patient. So different health professionals use the bikes in different ways, but all these people are people who work with the communities, and for some reason or another they have to go to the communities at some stage. For me, I really wish every health worker that needs to go to the community is provided with a bike, is able to do so when they are supposed to go, because we can have all the drugs in the world, we can have all the information, but if it doesn't get to where it's supposed to get, it won't have any impact. I would want to see this program continue forever. I think we have no choice, but otherwise we'll go back to the same problems that we had, and we'll still lose people when they could have been helped.